All right, we have the gluteus maximus as our muscle. The proximal attachments are the coccyx, the edge of the sacrum, and the posterior iliac crest. The distal attachments are to the iliotibial tract and the gluteal tuberosity. The actions of the gluteus maximus are to extend the hip, laterally rotate the hip, abduct the hip, and the lower fibers will also adduct the hip. For the procedure for the manual muscle test, the patient will be lying prone. You want to make sure that their knee is flexed to 90 degrees because that will put the hamstrings on slack so that you can isolate the gluteus maximus muscle. Then you're going to ask your patient to raise the leg up towards the ceiling.
All right, now what we're going to do is we're going to transition into actually performing the procedure we just went over. So she is going to be the patient, and I will be the student physical therapist assistant, of course, at Carroll Community College. Now, the first thing, what we're going to do, like we said in the procedure, is you want your patient to be lying prone. And prone as in meaning is sitting, well, not sitting, but actually laying on their stomach, okay? The next thing is you want to flex. So flex their knee about to 90 degrees, okay? And you want to ask your patient to raise their leg as far as possible towards the ceiling without the hip raising above, like getting off of the table. Now this right here, obviously she can do it. So this is a grade that we call 3 out of 5. And what the 3 out of 5 means is the patient is able to move against gravity, okay? Now the next grade is a 4 out of 5. And what that means is me as the physical therapist assistant, I will have to offer a little bit of moderate resistance to the patient. So what I'm going to do is I'm going to press against the patient just a tad, right up in here, and go ahead again. And I notice she can actually hold against the resistance. So that would be a 4 out of 5. Now the next we'll have our patient relax. The next one is a 5 out of 5, and that's the maximum resistance. So I'm going to put a decent amount of my body weight onto the glute max. So go ahead. And you see she can still fight against my resistance. So that would be a 5 out of 5 in the gauge of actually testing that muscle. The next thing is we are going to just show you some of the clinical presentations that would happen if you have a weakness in a glute max. The first thing would be the gluteus maximus gait. Now with that, the patient would present more of a hyperextended motion in their trunk just to compensate for the weakness in the glute max. And obviously with that, you would probably have some compensatory low back pain, and she'll end the last things for you.
Also, you could have some balance issues, especially when you're talking about in your gait cycle and your stance, you're using a lot of that extensor muscles, especially your glute max. So if you don't have good strength in there, you could have some weakness when you get into that single stance phase. Also, there could be some knee pain. And the reason is because the glutes actually prevent against the valgus stress on the knee. So what happens is when you're walking, it's controlling the position of your knee when you're walking, when you're running, when you're jumping. And a weak glute max would, cause a little bit more valgus stress on your knees.
And it's normal to have the valgus stress on your knee because the orientation from the tibia is more of it kind of sits in a valgus kind of presentation. So it's more medial than anything. So that's the reason why there is going to be a lot of valgus stress there. And it's more predominant like in women rather than men. So that's it for our video. I hope you guys enjoyed. And we're signing off.